Governor Larry Hogan walked up to a podium in front of the old Laurel Hospital to announce it's been reborn as Laurel Medical Center, a critical care facility for coronavirus patients. He said it went from zero to open in less than 35 days. It has 135 beds, 35 of them ICU beds, a staff of more than 400, and a leadership team from shock trauma. Hospital directors tell 11 News after a soft launch on Monday, 25 coronavirus patients are currently admitted, all part of the governor's hospital surge plan.
Adding 6,700 hospital beds in like 40 days is a pretty unbelievable accomplishment. And lowering that spike so we didn't have the huge numbers. Hopefully we're not going to need to use all of those, but I think we're going to be in much, much better shape than some of these places where you saw people stacked up in the hallways and running out of ventilators and not having ICU beds.
Today, Governor Hogan also confirmed a second Korean Air jet landed at BWI this morning, carrying more medical supplies from South Korea as part of Operation Enduring Friendship, announced Monday after the delivery of 500,000 coronavirus tests.
My phone was lighting up from every governor in America saying, how do we get some of those tests? I'm not sure what the answer to that question is because I think we're the only state that Korea had made an agreement with, but we're going to try to help everybody get here in the state of Maryland, first of all, but if we can help our neighbors and our other governors, find a way to help their states, we're going to do that too.
The governor also said today he signed a contract this morning to quadruple the number of contact tracers in Maryland from the current 250 to 1,000. And he said on Friday he will unveil his roadmap to recovery, to reopening our economy. Reporting live from Laurel tonight, I'm Kate Amara, WBAL TV 11 News.